day, Nigerians are struggling to find easy access to life-saving medication. We are here to change that. Drugstock is the leading pharmaceutical distribution company in Nigeria, and we are proud of the changes we have made. We have streamlined the logistics required to fulfill the needs of over 3,000 medical institutions like pharmacies and hospitals. We provide healthcare facilities with end-to-end procurement solutions. Drugstock is a one-stop solution for all your medical needs with state-of-the-art technology. Our dedicated Drugstock app keeps us connected to healthcare providers with all you need at the edge of your fingertips, allowing you to procure all your pharmaceuticals and medical products in one place. With the support of our talented and dedicated staff of managers, tech experts, drivers, and healthcare professionals, we continue our holistic approach of breaking boundaries with our distribution chain. The days of complicated searches and outrageous prices for pharmaceuticals in Africa are over. But we can't stop there. Drugstock continues to grow with several innovative technologies in the pipeline. We are spearheading the advancement of pharmaceutical cold chain storage and distribution in Nigeria. Our ultra-modern cold chain logistics system allows our client to track all cold chain orders and monitor temperatures in real time. Our multifunctional inventory tool, Pilometer, is an easy-to-use inventory management system for new and existing pharmacies. Our payment solutions, Drugstock Pay, offers healthcare providers flexible financing for all their procurement needs. At Drugstock, we value the positive impact we have on our society, and we believe in the future of Africa. We are honored to build it.
Great. Okay, I think we're okay. Amazing. Good morning, everyone, and welcome back. Welcome to another edition of Drugstock Learning. It's exciting to come back, to be back. We've been offline for about 2 months because we were at the ACPN conference in July, and then we had a panel in August. So yeah, it was nice connecting physically at both conferences, but now it's, I think there's this vibe that online gives you, and it just feels more, Drugstock Learning is back. So thanks everyone for joining. For those who joined early and you're still here, thank you for waiting. Thank you for joining early. And I think we'll start giving something for maybe for like the first 20 joiners, because punctuality has to be rewarded. Yeah, so again, I'm excited to be here. And before we went on our July break, remember that we had the Healthcare Business Masterclass series. That series was really impactful. We got a lot of positive feedback. And if you are yet to have, we made promises to give those who were consistent with the masterclass a couple of things. If you haven't received yours, please reach out to also that, because everybody must be carried along and everybody must be presented with their rewards. So before we go on, my name is Pharmacist Onyinye Chekwe, and I'd like to welcome everyone to this webinar. So it's a special edition webinar because, as you will see, all our panelists are pharmacists. This webinar is also how at Drugstock we are commemorating the World Pharmacist Day that was held last week, Thursday. It's really it's a wonderful thing to celebrate pharmacists, because pharmacists do a lot in every aspect of healthcare. Pharmacists are everywhere, and it's nice. I really appreciate FIP for the work that they are doing. Okay, so someone talked about the echo. Am I echoing, please? Please, I need feedback on that so that this is as seamless as possible. Please, is there an echo? Please, can we hear me? Am I audible? If you can hear me, please just drop your okay clearly. So just drop your favorite emoji so that we can know that you are engaged and you are here. I like to see the most common emojis that people think that are, yeah, thumbs up. Thank you. Thank you so much for the response. All right, so it's clear. Everybody can hear me. Great. Thank you for pointing that out, from Gloria. Okay, so as I was saying, this is in celebration of World Pharmacists Day, and we know that pharmacists are everywhere. So it is only natural that when we are talking about digital innovations, pharmacists should be at the forefront as well, because we are we are the first points of care for healthcare seeking individuals. So it only makes absolute sense that when we are talking innovation, pharmacy should also be right smack in the center of it. And that is what this is going to be about. It's going to be yeah, we have panelists, which I'm going to introduce shortly, but this is also going to be very, I want this to be as interactive as possible. I want you to share your experiences with digitalization or digitization. I'd like you to, even, and if anything resonates with you, when you hear anything that the panelists say, drop a comment or drop a question so that we also can learn what you're doing, what has worked for you, what isn't working for you, what you've tried, and all of that. So before I go on to introduce the panelists, I just want to say something very quick about drug stock. Okay, someone is saying no video. Please, am I still audible? Or rather, no audio. Am I audible, please? Or is this audio problem a collective one? Audible and clear. All right, thank you, from Manuel. Okay, great. All right, so I think you have to check your network. All right, thanks for the feedback. Great. So I was talking about drug stock, how so a little bit about drug stock for those of us who just joined the webinar and you don't have a lot of information about what drug stock or who drug stock is. Drug stock is on a mission to transform healthcare in Africa by ensuring reliable, affordable, and seamless access to quality medicines. So I know that there are a couple of clients on the call as well. So that's what we do. But beyond distribution of quality medicines and beyond ensuring easy access to quality medicines, we are also committed to empowering healthcare providers with the knowledge, tools, and partnerships that you need to thrive in Nigeria, in Africa. And this is also where drug stock learning comes in. So apart from our digital tools that some of us know about, drug stock learning also comes in to ensure capacity building and thought leadership for healthcare providers. So essentially, we believe that the more you learn, the more you know, and the more you know, the more empowered you are to actually make significant impact in your community. So that's what drug stock learning is essentially. And why did we choose this particular theme for pharmacists? Like I said earlier, healthcare has gone digital and pharmacists are right at the center of patient-centered care, wherever we are, whether in the hospital, whether in research or community, wherever it is that we find ourselves as pharmacists, we are in the middle of healthcare. So it is only natural that, again, when it comes to innovations, we are leading it. So from prescriptions to AI-driven clinical decision-making, that's clinical recommendations, to supply chain digitization, data-driven decision-making, all of this, culminates the entire to ensure that the time is as seamless as possible. So like I said, we have an interesting lineup of speakers today, and I'll just introduce them very shortly. So we have from Michael Okafor, from Chinedu Onwuka, and from Karim Adeniji. It's an all-male platform today, which is quite interesting, because in the middle of all of these things, I had to check like what gender adopts digital more, and I'm seeing that it is male. So I am very I'm also using this opportunity to call on everybody, right? Adoption of digitization practices should be something that is as widely accepted as possible. So before I go further into that, I'm just going to introduce our panelists. From Michael Okafor, welcome. Thank you for joining us. He is the CEO of Drugwell Pharmacy Limited, which is a rapidly expanding network of 9 community pharmacy branches across Lagos. Well done, sir. He holds a degree in pharmacy, a master's in public health, and a Prince 2 certification in project management. With over a decade of experience in the telecommunications sector, Carmichael brings a cross-industry perspective to healthcare innovation. Carmichael is passionate about modernizing pharmacy practice through digitalization and biotech, leveraging data, automation, and smart systems to improve access, to improve efficiency, and to improve patient-centered care. His work bridges traditional healthcare delivery with emerging technologies and positioning community pharmacies as vital hubs in the future of global health. He is also helping to reshape community pharmacies into modern health hubs that meet the evolving needs of Nigerians nationwide. Thank you for joining us from Michael Okafor. We appreciate your time here. Yes. Fam Chinedu Omuka is a pharmacy manager at Medicines for You Limited. This is a UK-based pharmacy where he oversees patient access, medication counseling, and community health initiatives. In this role, he navigates the daily complexities of pharmacy operations while also practicing as a travel health consultant and clinical weight management pharmacist. With early professional experience at FMC Enagua and the Federal University of Agriculture, Abeokuta, Fam Chinedu has gained hands-on exposure to both hospital and community practice. He has also undertaken trainings in data collection systems, which has equipped him with the digital skills needed for pharmacy's evolving future. Thank you very much, Fam Chinedu. I also know that he's expanding his skill set through a coding boot camp as a budding web developer. Well done, Fam Chinedu. Thank you for joining us. And then lastly, we have Fam Karim Adeniji. Fam Karim, thank you for joining us. Fam Karim is the managing director of Tabade Pharmaceutical Chemists Limited, a family-owned, diversified Nigerian healthcare company that was established in 1977. That's a long time. Well done, Fam Karim. Tabade Pharmaceutical Chemists Limited operates across many healthcare subsectors, such as the pharmaceutical retail, laboratory services, biomedical diagnostics, smart AI data platforms, optical imaging and eye care products, and maternal health. He obtained a Master of Pharmacy degree at Cardiff University and has completed a BSc in Biomedical Science from Ulster University and a Master of Business Administration degree from University of South Wales. Fam Karim is a determined healthcare practitioner, and he has over 16 years cross-sector experience across pharmacy, biomedical technology, and business administration. He has also been a key resource person for pharmaceutical companies like GSK Nigeria, Zulon Healthcare Limited, and Bayer Nigeria Limited on the roles of pharmacists in many ailments. Fam Karim, thank you for also agreeing to be a resource person for us on this session. We appreciate it. Now, without wasting any more time to the meat of the session while we're here. And it's going to be, like I said, it's a panel session. So I'm going to be asking questions and I'm going to be getting insights from our panelists. But again, let us feel free to use the chat button or the Q&A button, anyone that pleases us, so that this can be as interactive and engaging as possible. I know that, fine, we have 3 people on the panel, but I also know that everybody on this call has had their experience with digital, whether positive or otherwise, and I'd really like to hear all of the experiences, even as we talk about innovations. Great. So I'm going to start with Fam Michael. So Fam Michael, I'm very interested in your own, I was interested in your bio because of the telecoms then I saw. And I like to know, I know that telecommunications, when it comes to technology, they are like light years ahead because they also get on new tech as often as or as frequently as possible as it comes. So again, like I said, you bring a rare cross-industry perspective with your background in telecommunications and now in healthcare. So for Michael, what lessons from telecom digitization can be applied to innovate pharmacy practice in Nigeria and across Africa? For Michael,
Thank
please
you so
confirm that you
much.
heard the question. Okay, great.
Yes, I can hear you. Can you hear me?
Yes, I can. Yes, I can.
Yeah, so I just have the nudge just to reaffirm what we already know, because sometimes we talk about digitization and it sounds so up there. Basically, digitization is about replacing manual effort with technology. That's basically what digitization is all about. With my over 11 years in the telecom sector, and haven't been there and risen up the ladder, there are a number of things about the telecom that is quite interesting. Just to give us a little insight, and then I'll draw the lessons into the pharmaceuticals. In the telecoms, virtually every aspect of the business is digitized. I used to remember those times as a state manager. From my table, I get all the reports of the things going on. I give a very good example. From my table, I know the areas in Lagos State that the networks are down. I know the towers that are down. I get those reports. I see them on my screen. And for some instances, the engineers are able to resolve some of those issues from the back end. Other instances, they have to send resources, agents on the field to go resolve those things. So, to a large extent, a lot of things are being done without physically interfacing with the matter or with the situation, and that's how digitized that the telecom sector is. Now, coming into the pharmaceuticals, the lesson I learned from the telecoms, the fact that because of the level of digitization from the operations to customer experience to payment to security to fraud, to a large extent, they have a firm grip and a firm control of how the business runs and how the business is going. Now, looking at it in the pharmaceutical sector, especially let's look at it in the community pharmacy space. How can a pharmacist have a firm control and a firm grip of what is going on in the pharmacy, in this community pharmacy space? How is he able to influence? How is he able to change things, tweak things, and make things better? How is he going to replace some of those often repeated manual operations with technology in such a way that those things are automated and is able to, satisfy and give access to a whole lot of people? That is what digitization is about in the pharmacy space. Like, for example, and some of these things I'll be saying because it's evolving. Some of them are already in operation here in Nigeria, while some are still, ahead of us. Examples like automated dispensing systems. I know in the Western nations that is already being done. You don't manually dispense. To a large extent, this is automated. But some of them that we're already aware of, like inventory control, our softwares, they enable us to be able to have to take charge of what is going on in the business. From there, you know whether a stock is expiring, you know whether a stock needs to be replenished, you know whether you have to reorder. Some of those things you get to know them through a very good software, inventory management. There are also, the e-prescriptions where doctors can make prescriptions and even pharmacists can also prescribe some basic, prescription for some ailments, for patients that are not, physically present. All of these are digitizations. Also, areas regarding health records, these things can be electronically recorded rather than having a physical book or a physical jotter where you take records of your patients. These things can be done electronically. There are also the areas of telepharmacy where remotely you can give access and you can engage people from afar. Then the online pharmacies, these are also forms of digitization, where customers can engage. Customers will go to your website, see what you have, and then are able to pay online. All of these things remove human interaction and makes this very convenient and easy. Currently, there are some softwares and systems that are AI powered. They enable these systems, they enable the pharmacists to be able to, identify cases of drug interactions, how to optimize the dosing of drugs and all of that. Now, if you look at the plethora of all I've said, when we have increasingly more of our operations digitized, then you see that the system and the profession becomes more interesting. One of the things that makes the community pharmacy space unattractive to a large extent is the level of manual operations that goes in there, and it can be so overwhelming and so difficult. So technology has come to make things a lot easier. And then based on the information you get from technology, you're able to make smart decisions and make smart moves. Thank you.
Wow, thank you very much, Michael. That was really spot on, and I like all the aspects that you mentioned. So it's a lot of integration. I think the inertia for some people is actually starting. Most people on this call know that these things that's going tech is easier, it makes work lighter. But there is I feel that there is a sort of inertia amongst people, amongst pharmacists or healthcare providers generally to start. So it's like a health behavior or a behavioral concern. But yeah, you talked about records and westernization. So we have one of our panelists, Chinedu, who is currently practicing in the UK. So I'd like to hear your thoughts about how it works there, how different it is. You've also practiced in Nigeria, now you're practicing there. I'd like to really know the salient points that you would see that are different. But before that, I have a question for everybody on this call. And the question is this: just as you listen to the conversation, I just want you to draw insight and I want us to think about it. If you have the question, if you have the response, fine. So my question is, which area of pharmacy practice do you think will benefit most from digitization in the next 5 years? So I really like to hear our thoughts on that. Which area of pharmacy practice do you think will benefit most from digitization in the next 5 years? So the panelists are going to talk about a lot of areas. Michael has touched points on a couple of areas. But in your own practice, in your own line of work, which do you think will benefit most from digitization in the next 5 years? I'd like to hear our thoughts on that. So back to you, from Chinedu Onwuka. Having practice please, as we drop our answers, I'd like us to put a bit of why you think this is so. So if you feel it's hospital practice, why? If you think it's data-driven decision making, why? Just like that. So from Chinedu, having practiced in both Nigeria and the UK, what differences have you observed in how digitization is applied in community and hospital pharmacy settings? And what lessons can African pharmacists learn from these approaches? I'm really excited to hear your thoughts on this from Chinedu.
Thank you for
Can you hear
me.
me, please?
Yes, I can hear you. Can you hear me?
Yes, I
Good.
can, yes.
Cool. Right. So fundamentally, I've come to see that pharmacy is the same across both countries or both nations, Nigeria and the UK, and I'm sure it'll be fundamentally the same in other countries as well. But where the difference is in health records, and I think that's really key. And I'll give two instances. In Nigeria, the average person comes into the pharmacy with a prescription, and you serve the person their medications and stuff, and that's the end of that interaction. If he comes in 2 weeks' time, you have absolutely no records what you gave previously, or what the person has, what the comorbidities are, things like that, and that is just playing it by the ear, just basically freestyle in pharmacy, if I'd say. In contrast, in the UK, you have a system where prescriptions are sent directly from the cloud, the NHS cloud. And the advantage that gives is that, firstly, people don't really need to come in physically with their prescriptions. That's already on the cloud. They see a GP or go to hospital, or the GP mostly. see a GP, pull the prescriptions down from the cloud, and process those prescriptions. Now, the additional thing you can do is you can access patients' medication histories. Firstly, on your PMR, your patient medical records in the pharmacy. And basically, what that is when you dispense medications, you have a record of everything dispensed. So if you have a patient who's been with you for the last 10 years, perhaps, you have an idea what they have been on for the last 10 years. And that's not even going to their summary care records where you can check their medication history, their medical histories, and things like that. So you know what this patient has been on for the last 10 years, and you're able to pick out things like, um, what's the word? When there's a technical word for it, but when people have several medications, multi-pharmacy, yeah, that's the word. So you can pick out things like multi-pharmacy where people have several medications, where people haven't had a medication review in years. So someone is on hypertensive medications, for instance, and maybe he started off on amlodipine, and over time he's gone up to different other medications. Over the course of years, there could be instances where the medications have not been reviewed. But as a pharmacist, in that instance, you can see where medications are not really needed and call that out to the GPs or the hospital, whichever the case is. On the reverse, when people are being admitted to hospital, so we have patients on multi-dosage systems where you dispense dosage boxes, especially for people who are not don't have the mental capacity to take their medications. Now that helps with medical adherence, but when they are admitted to hospital, we get calls from hospitals to check what medications they've been on. That won't be possible if you didn't have their medication history. So basically, the contrast will be if put that put let's put that situation in let's go back to the Nigerian situation where somebody comes in with a prescription and you have absolutely no records what they've been on previously. If there's a medical emergency, for instance, are you able to tell the hospital what they've been on previously, if there are interactions, if there are medications that have been recently stopped or started? You have virtually no clue what's been on, what the patient has been on. So I think that's the striking difference. Like I said, fundamentally, it's the same thing. You serve medications, you provide pharmaceutical services, pharmacological interventions, and things like that. That's fundamental. But where we need to step it up in Nigeria is in proper medication history, proper medical records for patients, so that we provide better services, more holistic services as pharmacists. Thank you.
Thank you very much, Fam. Yeah, so polypharmacy and the like, it's interesting because I know that in Nigeria, I know that Drugstock has a pharmacy management system that records and takes patient records and all of that. I think it is like we're getting to that point where systems will start speaking to one another, right? And we are getting to that point where it's going to be a lot of more conversations going on so that patients' histories can now be shared across board. Yes, that is an interesting vision for healthcare in Nigeria. Thank you very much, Fam Chinedu, for sharing that. And then Fam Karim, good morning, sir. Or still in the morning. Good morning. So given everything that we have heard now, um,
Morning.
I'd like to know, so in your view, how can pharmacists across sectors now, because given what Famchinedo said about the health records and talking, it means that in Nigeria, there will need to be a whole lot of communication between hospital pharmacists, community pharmacists, and other types of pharmacies that are involved in the whole process of healthcare, in the entire flow. So in your view, how can pharmacists across sectors work together to leverage technology for global public health impact?
Right. Good morning, everybody. Can you hear me?
I can hear you. I hope
Can,
everybody else can.
can everybody hear me?
Yes,
Okay.
we can hear clearly.
Please.
Right. All right. Okay. Okay, I'm happy to be
Great.
here. Thank you to Drugstop. So actually, I also worked in the UK briefly, and I totally see where Famtinedu is coming from in terms of digitalization. And so it actually works quite seamlessly because using the prescription example, we're not talking about people just walking in. You can have your repeat prescription sent in a monthly cycle to your pharmacy of choice. So even before your next cycle is there, is already prepared. So you just go in a month clockwork, you pick it up, and what that it just makes the whole city and it just segments the work efficiently. So in terms of community pharmacy and pharmacies in hospital, having digital services in place just increases healthcare access, improves medication adherence. I mean, Famchinedu, Pharmacare has spoken about it in terms of knowing what your patients are on and being able to follow up with them. Using the UK example as well, there's something called medicines use review, which is done yearly. Sometimes people are on many medications, polypharmacy as alluded to, and sometimes they're not even taking one or two of them, and it's just a loss, really. It's a loss to the system. That's if you have like a national insurance system. But in our own situation, it's mainly out of pocket, so the customer is who's losing the most. So pretty much what we are talking about is just moving from the manual setting and really from where we are. We just really need to look at where we are and see how we can adapt things. We might not be able to do the UK model for now. And funny enough, UK is not even probably top 10 when it comes to digitalization. We are looking at countries in the Nordics, you're looking at Estonia, where 99% of the population sometimes have their health records online. But I think what would work mostly for us here is mobile, because everybody's on a mobile phone, but not everybody's on every kind of digital device. Now we can look at some in the mobile platforms to digitize customers and do follow up that. I mean, one of the most interesting initiatives right now is the Nigerian Digital in Health Initiative by the federal government. So they are trying to harmonize all data sets and put them in a NIN and all these things that just, we have one seamless platform. And as digitalization continues to evolve, it's only going to transform how pharmacists practice. And it's going to integrate the system more. So you have pharmacists working who's at the heart of the whole healthcare system anyway. And then you just, for me, like I said, I think our best approach would be to try the mobile phone approach and try and bring all the customers on there and try and provide services on there. Health records have been spoken about, very, very important. Telemedicine is another whereby, pharmacists can collaborate on that and other healthcare practitioners, essentially meet the customer where they are if they're not in your location. And it just makes the whole healthcare service more personalized. So everything we've said is essentially is about incorporating digital practices to ensure that decision making can be made faster because you have more information, and a lot of the time it actually brings down the cost because we're actually in a low resource, low infrastructure environment. We have few pharmacists, few doctors. So sometimes we need to actually reach patients digitally, reach them where they are, really, because they are sometimes hospitals, pharmacies are kilometers away from the patient. We have some states in Nigeria where there are only 2 registered pharmacists. So I think digital for us is actually not a luxury. It's something that really needs to be adopted if we want to improve patient outcomes, enhance patient engagement, and increase efficiency really across the pharmacy services. Thank you.
Thank you very much, Ma'am Karim. Please, am I audible?
Yes, we can
Can you
hear
hear
you.
me?
Yes.
Okay, great. Yes, I don't know if it was my network,
Yes.
but your screen was frozen at some point. So I don't know if it's my network or yours, but I'm hoping it's something that can
Oh,
be fixed, and I'm hoping it's not my network particularly. Okay, so I've gotten a lot of interesting responses from the question I asked, and then Evelyn is saying community pharmacy and hospital pharmacy. Farm doctor, Brambifa. Yes, yes, I agree. But why? Okay, I've had a lot of responses that said community pharmacy with reasons, but I'd really like to know the angle for hospital pharmacy as well. And then someone says community pharmacy because they have the opportunity to revolve. And I think I actually agree with this because community pharmacies have independence, right? So they can make decisions like it's their facility, it's easier to make decisions, it's easier to evolve when necessary. I think it's just flexibility that Van Barakat is pointing to here. And then another interesting one I saw is that pharmacies are the most accessible patient healthcare provider, interaction with pharmacy, inventory record keeping. Exactly. So, and this is also a very fine point. Community pharmacy. I don't know why we're having a lot of community pharmacies. I don't know if it's because we have more community pharmacists on the call, or even pharmacists in hospital that are also saying community. But these are really great angles to it because pharmacies are very accessible. So you could have patients that go to like 10 different hospitals, or what am I saying? Like 50 different hospitals, all having one pharmacy as their go-to pharmacy, right? So yeah, I totally agree with that. Record keeping is key for that. And then yeah, so data. Yeah, I'm seeing another one on data. And then Emmanuel is talking about community pharmacy as well. Yeah, so I want to see more, more angles to it. I've heard a lot about community pharmacy, and I would like to hear more about other aspects of the practice. So, Fam Chinedu, please, I'm coming back to you because Fam Karim pointed out something very significant, which is the cost, right? And when you're talking about public health, we know that it is about healthcare really reaching those that need them the most, about health equity as much as possible. We want healthcare services to reach those in underserved areas, hard to reach areas. So I'm going to be asking this about patient access. So from Chinedu, you've had training in software and data collection systems. So how can pharmacists use these data-driven insights to improve public health outcomes, especially for underserved population? Because we are collecting a lot of data. So how can we, mine all of these data, analyze them, or all the technical words, and then use it for the benefits of patients everywhere, especially those in areas that are underserved?
Mm.
Did you get that?
Yeah, I do. I get it.
Mm,
Yeah,
okay.
I think that's going to be quite difficult in Nigeria given the systems. But like Karim said, I think the most accessible thing that people have is mobile devices, and that might be the way to go at the moment for Nigeria. Now, with those such systems, especially in undeserved areas, you have the advantage of monitoring patterns like medication use patterns. You can also monitor things like disease prevalence in those such areas. So if you are able to monitor what medications are used the most, you have an idea what sort of health challenges they have. And I think it's easier to tackle such problems given that you're also able to monitor adherence if you have systems like mobile devices in place where they have timed, um, they have um, they have different times where people take able to prompt people on medication use and things like that. So if you're able to incorporate mobile devices, patients daily medication use, over time you're able to improve medication adherence, which is really big for people who don't really have the edge of how things work, especially with medication. And I think that's something that is a huge. I 10 million who use them up to a certain point. And they think they get better because they get better over time. They think they can get off the medications. Now, if you have devices, if you have the technology to monitor those patterns, medication use patterns, then over time you can help those people improve adherence. Because to be fair, they don't know any better. Um, it's such a so basically you have people who I'm sure we've all heard of those instances where people take 4 tablets of paracetamol because they think if it's a strong headache, they need 4 tablets to get over that headache. And it's the same with different other medications. And it's just the lack of awareness. So having the technology to monitor medication use and also prompt patients on when and how to use their medication will help. That's could enhance medication adherence. But also, we also need to look at the fact that people in undeserved locations or places struggle with discerning what the right thing to do with medication is. So I think pharmacists should also find a way to simplify information, just make information more accessible to patients in those such areas because in most cases the focus is in cities and places where people already have an idea what they are doing, but you also need to make the communication a lot easier so that people in less privileged people understand what you're talking about and are able to follow based on the advice you provide as pharmacists.
Thank you very much. Thank you. I mean, I heard a lot of things you said. I hear you when you say medicine use patterns. That is very key because it's the access to medical information, access to health information as well. Because truth be told, when we compile data, when we collect data in the cities, there is it's totally different from what we get from all of these populations, all of these areas that don't have as much access to healthcare. And the ease, I think the key thing is ease, making this thing easy, whether with the use of mobile, also bearing in mind that these people don't have, not all of them have smartphones, not all of them even have phones. Some of them just have not even a PPMV, maybe just a house that they go to take care. They just have, maybe there is a nurse who isn't actually a nurse or who is just someone that happens to maybe know a thing or two about, in fact, 18 or two is even saying too much, which knows, like, who hasn't even scratched the surface, just knows something very little about healthcare, the rest. But that person is seen as the doctor in that place. Not may even just even be a pharmacy, it may not even be a chemist, it may not be this person's house, or call this person when you are ill. So it is very important that in these areas we look into how we can make these things easy, ease of access of information, ease of healthcare. When we are doing telepharmacy or when we are doing telemedicine, how are we thinking of getting these things to underserved populations? So is it going to be with services? What prompts are we going to use? It's important to look at all of those areas, and data will help us to see how this thing works, how their behavior works. I said something about healthcare behaviors earlier. Okay, that was for pharmacists, but even more so for the healthcare seeking people, them individuals. The healthcare behavior is important for us to note and to study. How do they work? How do they think? What do they even know? Because their knowledge informs their behavior. Yes, so I'm hoping we should even have a session on this, how to use people's behaviors to create impactful solutions for them. I think that's something that we do. I know that's something that Drugstore prioritizes as a company, but I think it's like maybe more tech companies should at least start looking into that as well. Thank you very much, Fam Chinedu, for that bit. And so Fam Karim has something to talk about, okay, in the comment section. Okay, for me, the rise of AI will aid drug information departments for hospital pharmacies, especially. Yeah, so AI too. In fact, I yeah, so I'm going to go back to you, Farm Michael, right? Still talking about technology and automation and smart systems. I'd like you to share examples of how these are improving access, efficiency, and outcomes in your pharmacies. Farm Michael.
Okay, thank you, and I really want to appreciate the thoughts from Farm Chinedu and Farm Karim. I think very apt points they've made there. Now, regarding examples of how digitization is making for me particularly, making community practice easier. Um, I just want to use just an example, just as a way of um, clarifying this or passing across this information. And it's not only making it easy for me, but it's also making it easy for the customer, talking about the patients, and making it easy for the whole system. So I'm sure a good number of people on this platform are aware that there are systems now that are available where once you are connected, you get prescriptions as to what patients want. So by this, I mean that you can be in the comfort of your pharmacy space and then you get a prescription. And I think Famchinedo alluded to it. I'm sure it's already very common there, but here is something that is evolving and growing. And so you get prescriptions, and you fill up those prescriptions, and probably the same day or the next day, the patient just walks into your pharmacy and picks up the items that he wants. For the patient, it is a lifesaver. One of the things that patients do not like is going from one pharmacy to the other, looking for where to find a particular medication. That can be very problem. Some of them are platforms like the Good Pill and some others, where because of the system that they are connected to with HMOs and others, these patients just go in there and I mean the prescription, these patients prescription just get in there from their system, and looking at all the pharmacy networks in their chain, they know the particular pharmacy that has this item in question. And all they need to do is just tell the patient, go to this particular pharmacy and go pick your drugs. Look, that makes life very easy for the patients. That reduces the stress, And then for the pharmacy, that is an opportunity to be able to serve more people. And even in terms of the business part of the profession, that is an opportunity to add more, business to your operation. I cannot overemphasize how that digitization is making life easy. But one of the things that people forget is the fact that apart from making life easy, digitization enables you to scale your activities and be able to serve a whole lot more people than you are currently serving right now. So that I take as a very good example of what currently that I operate. So in my pharmacy, I have prescriptions. And pick it up. No long queues. It's already labeled, and the direction on how to use the drugs are already put in place. And the patient just comes in, picks it up, and goes. Everybody's happy. The patient is happy. No too much hassle. Trying to look for where to get the medications and all of that. this is just one of them, as one of those ways that digitization is making life easy for the community practice. Thank you.
Thank you very much, Michael. And it's very interesting what you said about, access to medicines and how patients don't like to go from place to place. And yeah, you mentioned the good pill. That's one of the innovations from drugstore where people, HMOs, can just easily, integrate with pharmacies. And I think the bottom line for any innovation in healthcare should be making life easier for the patients, right? And I've had experiences with HMOs, in the past where I was promised, you get your drug, we'll reach out to you, you will reach, and all of that. But, nothing happened. But of course, as a pharmacist, you don't wait. I know to go and, do out of pocket, but not everybody is aware of this. Not everybody would be so inclined. Some people don't even want to take the medicines in the first place anyway. So when they hear that, okay, we'll reach out to you, and then nothing happens, they just relax and they don't bother to follow up with their meds. So I think it is important that all of these aspects are considered when we are looking at access. So thank you very much, Michael, for that very key perspective. I also wanted to say, as a follow-up on what Fam Chinedu mentioned about the underserved population, I'd like to know if we have any pharmacist or healthcare provider here who works in a setting that is not urban or in the city. If you're in a rural setting, I'd really like to know how it operates there and how you combine, how you're able to reach around the health behavior of these people to actually, meet them at the health needs. So if you have anybody on the call who is, who works in this setting, or people on the call who work in this setting, I'd really like to hear the points of view in the chat. And while Michael was talking, um, a comment came in from God's Will, and he says that a national health record system in which every of the patient's healthcare information and detail can be recorded, irrespective of the facility the visit, is very key. Yes, I agree. Also, an overall integration between healthcare providers is also relevant. It will be enabling connections among healthcare providers in terms of facilities and professionals. So we should have not just systems speaking to one another, but the people too, pharmacists speaking to one another. Thank you very much, Fam Godfrey, for that very insightful perspective. There should be integration both among the systems and amongst the people. That is very accurate. So we have questions. Please, if you have a question, just put this in the Q&A box. I can see that we have a question there now from how can we protect patients' data, medications, history, if they are stored electronically? So do we want to answer this now, or should we conclude with the session? Fam Karim would like to answer this question. Great. So Fam Karim, the question, how can we protect patients' data, medications history, and so forth if they are stored electronically, and are there legislations to ensure accountability? Fam Karim, please, you have the floor.
Yeah, okay. I was
Fam
actually looking through
Yeah.
the questions, and I think I clicked it by mistake, but I'll try my best. Can you hear me?
Okay. Yes, I can hear
Can you
you.
hear me?
Yes, I
Yeah.
can.
So, okay, I'm no data expert, but I'll try and say what I know. So in terms of data protection, so we do have like a data, that is the NDPR, that's Nigeria Data Protection Act, that clearly outlines how data should be used, how it should be stored, how it should be destroyed.
Yeah.
So in our own situation, obviously there needs to be restrictions to access. The people that can access this data, and they're only going to access it for the needs specified, especially if you probably want to dispense a prescription or want to give advice, things like that. Then also data anonymization, whereby you can remove you can remove any identifier of the patient, like name, age, sex, sorry, gender rather, and you can now from there just deal with any specific issues outside that. So that'll be my short answer on that. Probably Van Michael might be more of a data guru than I am. Someone else can add to it.
Yeah, yes. So if I'm
Yeah.
in line with what you're saying, in fact, I even want to respond to the question you asked earlier about how to serve those in the underserved areas. I'm probably connecting it to what Fam Karim have just said. First of all, I want us to not underrate how far the mobile penetration has happened and data penetration in Nigeria. Now, as of today, Nigeria has about 172 million mobile subscribers. Now, I agree, you might say some people hold more than one phone and all of that, but it gives you an idea. In fact, the data says that there's 87% penetration across the Nigerian population of 280 million. And one of the ways that we can empower, especially the primary health centers and some of those, centers where we have very low qualified medical practitioners, is such that we can empower them and they in turn can now interface with these other people probably who do not have mobile phone or data, internet usage. Now, in terms of internet users, we have about 107 million Nigerians are online today. Now, I'm reading out this data just to let you know that we have gone further than you think. In my village, I'm from Anambra State. From my village, there is data, there's GSM. It might surprise you what is going on there. Those places you're talking about, some of them have smartphones, and all of them have smartphones. So I think the real issue is, number one, the political will on the part of the government to really reach these people and do what they need to do. And secondly, a lot of the medical professionals don't want to operate in that space, in those areas. All of them want to be in the city. So there has to be some way to incentivize the medical professionals to go in there and then, serve these people in question. But to say that probably because of technology in terms of internet or mobile telecommunication, that these people are not probably reached or underserved, it's not really so. It's the willingness of the government to do what they ought to do. Now, a number of things that Fam Chinedu has said, you see that to a large extent is because of the order they have there. There is a centralized data. Somebody alluded to it, talking about integrating our data in such a way that the doctors or the medical service providers interact with one another in such a way that it will benefit, the patients. There is a part for government to do, but for us here, to a large extent, we work in silos. Nigeria has been working in silos. The medical professionals have been working in silos. We're not, there's no coordination around what we are doing currently. And so that the best that can happen is exactly what Fam Karim has said, reaching the people through the mobile phones. But that comprehensive approach to serving everybody in Nigeria, there has to, first of all, be, the part of the government doing what they ought to do in terms of, harmonizing our data and centralizing it and creating a system in such a way that the medical providers interact with one another and together serve the people who need to be served. So that's what I want to say, just to let us know that the real issues are not so much about the infrastructures. Yes, it might be here and there, but that might not be the real issues. Thank you.
Yeah. So regarding data protection, can I answer that question?
Yes, please. Yes.
Right. So the way it works here is everyone has a personalized smart card, and that gives you accountability. So if you access someone's summary care records, for instance, there's an audit trail to say you have accessed their records, and you just don't access medical records because you can't access them. There has to be a reason behind accessing them. And ideally, there's someone in charge of supervising who accesses what records. And obviously, if they feel like there's been an indiscriminate access of someone else's records, they can flag that up. So that gives accountability where you're not just accessing records because you can. And additional to that, access is given on a role-based basis. So as a pharmacist, there are certain things you can access. As a pharmacist in a community setting, there are certain things you can access. As a pharmacist in a hospital setting, you have more access to the patient's records. Now, if you're just a dispenser or a pharmacy technician, I'm sure there'll be um, minimized access in that sense, but it's largely role-based. You just don't have access because you have a card, and you don't access records because you can. There has to be a specific reason to access those records. So that would be one way to provide accountability and put data protection, because it then means that you're not accessing your brother's records because you can access his records. You're accessing them because there's a medical need for that. And if it's flagged on, then you have to be able to defend that, if that makes sense.
Yes, thank you. Thank you very much, Fam Chinedu. I also happen to have a bit of information about data because, at DrugSoc, we have an inventory management system, Kilometer, that has a lot to do with data. So before I go into that, I'd like to first say that I think it is also the onus on everyone who has a product or any form of system that will require data to make sure that that environment is protected. I know that, like Fam Karim said, there's an agency for that, and you have to be licensed because you have to meet a lot of standards. So for that pharmacist that ask, first of all, whenever you're gonna get on board to do any product or to partner with any tech, ask the relevant questions, right? This is my data. How is it going to be used? How are you protecting it? Do you have a license? Do you even have clearance from the agency and all of that? So now coming back to home, for DrugSoc, how we protect data is something about, just like Fam Chinedu said, role-based access. Sometimes what the pharmacist will see or can access, the cashier will not be able to access it. What the procurement person or the finance person can access, other people who do not need access to that particular data will not be able to access it. And when it even comes to patient information that you save in your device, in your Kilometer cloud, you can set it such that nobody else apart from the pharmacist who needs that information can access. So at the end of the day, it is is to ensure that whatever it is that they are giving people or professionals to use is protected. And at DrugSoc, I know that it's also it's necessary to point that out. So I'm very grateful for that question. Thank you for pointing out that. I hope we answered your question. I hope we gave you the response that you want. From if we did more clarity, just let us say. On
Is it
what's
just
the
me
good
or family here is frozen?
Oh my goodness, am I frozen?
Yes, you are.
Oh, am I still frozen?
Well,
Okay,
can
can
hear
you-
you now.
okay.
Can you hear me?
No, yeah, you're good now.
Okay, great.
Yes.
Okay, Frozen, all the talk about Frozen is reminding me of the movie. But okay, let's go on. So someone asked about the Good Pill. So the Good Pill is a platform for pharmacists and users. How it works for pharmacists is when you get on board the Good Pill, it helps you to get those individuals who want to get medications to access your pharmacy easily. So once you get on board the good pill, your pharmacy becomes visible to anybody that needs to order for a medication. So just think of it as an what's it now? As an Uber for medicines. So that's when you're on board, you can see orders, you can choose to accept, you can, fulfill orders for people. It increases traffic to your pharmacy, because even people that that see you on the bill, individuals and always work with you, walk into your pharmacy. Isn't a pharmacy, you can be in a particular place and people in your area don't even know that you are there. So what the good pill does is it helps you to be visible to people both in your area, to people outside your area. And for patients, it makes it easy for them to access medicines via either, directly with the pharmacies or via their HMO. There are a lot of partners with us on the good pill. So I think we'll drop the link for anybody that wants to find out more about the good pill too. So we'll share the link and then you can go on there and find out more about the good pill. So Famchama asked about the ROI on websites. And Fam Karim has responded about the e-commerce thing. I know it is not setting up an e-commerce website is not easy, I know. And it is this consideration also that informed the good pill initiative that we have, such that even if you don't have a website, you can still get online orders regardless of whether or not you are online or not. Yeah, so okay, we'll go on with the comments section. But first let me pose this question to Fam Karim. So Fam Karim, you work across pharmaceutical diagnostics and maternal health. So now I'm looking at digitization, transforming pharmacy practice, right? And I want you to personalize this across all of these aspects that you work with. How has technology enabled you to create impact across these diverse areas? Please, I hope I'm not frozen. I hope I am. You can see me.
Yeah,
So,
I
Fam
heard
Karim,
you.
yes. So, how has technology helped you to create impact?
Yeah, I
And
hope
in your
you hear me as
experience, what
well.
technology? Yeah. Okay. First answer, then I'll ask the second part of it. Did you get the question?
I think you said,
Hi, Fam Karim.
how was my experience?
Yeah.
Yeah,
So, yes,
can
across
you hear
your,
me?
I can hear you now. Yes. So how was your experience across
Okay.
pharmaceuticals,
Okay, ask the
diagnostics,
question again, please.
and okay, I think there is a lag. I think there is a lag. So I'm asking the question again. So how has your experience across pharmaceuticals, diagnostics, and maternal health helped you to create impact using technology? So I believe that you use AI, automations, and different forms of technology across all of these, your experiences that you have. So how has technology helped you to create impact across these areas, across diagnostics? I know you have a laboratory. How has leveraging technology helped you with that? Also with maternal health, how has tech helped you to,
Okay.
become
So,
successful at that? So just real life experiences basically for our audience.
yeah, so I was just noting them down. Yeah, I
Okay.
was just noting them down. Pharmaceutical, diagnostic. Yes, for us in 2019, we started to diversify and we started adopting technology and offering some technology services. Uh, in terms of the pharmaceutical part, is pretty much what we just discussed about e-commerce on the very low level products that we market specifically, and that way we can follow up with providers and customers. But one of our major fields of work now is in diagnostics. and not necessarily just like your diagnostic center, like doing a normal common test. So we provide some digital devices for screening, especially eye screening for diabetic retinopathy. And that also has telemedicine capabilities, going to also help in the future, like I mentioned before, with our low resource in terms of human resource and infrastructure. Telemedicine also helps you bridge that gap. So in terms of what we're doing with imaging for diabetic retinopathy is complication of diabetes that affects the eyes. You can take the image, you can image the back of the eye, and essentially you can send the image to an ophthalmologist in any country, UK, Ireland, wherever, and then they can grade it for you. So even if you have a deficit in terms of experts locally, anywhere you can get access to proper diagnosis. So that's when you combine telemedicine and diagnostics together, essentially it just narrows the therapeutic window for patients. Patients can get real-time access wherever they are, rural, urban, and the likes. So it breaks down geographical barriers essentially, and that's where kind of area where resources are low, you can essentially just leapfrog, set your system on that digital platform, and then people can access care centrally. So you can build a central system where you collect this data. If it's images you're taking, for instance, it could be X-ray, could be imaging, could be any test. If you can centralize the data you can send the results back to the patient or to their healthcare providers. So we've been trying to adopt telemedicine with those services we are offering. That's for the diagnostics part. AI platform, actually, someone we started to around 2019. Funny enough, before the onset of ChatGPT and the likes, we're doing something similar in terms of training AI platforms around maternal health. And it's like asking the most common questions, even us. And that's how the training for getting massive supercomputers to really generate this question and answers really at a very fast pace. So that's pretty much what my real world experience of digitization is. Because I've probably come out of community pharmacy a bit. I'm now a public healthcare pharmacist, ophthalmology pharmacist. But essentially, digital is what brings everything together. So whatever it is, if it's results you're getting from a test, if it's information you need, if it's from an image that needs to be created, everything can just be put in a digital space, and you can get quicker and faster results, both for the pharmacist and the patient. Thank you.
Thank you very much, Fam Karim. I really appreciate that. Please, am I still audible? Okay.
Yes.
A bit low now, I think.
All right, great. Okay. So yeah, thank you for that insight into your experience with tech. I also want to quickly ask because we have to move fast now. Our time is fast spent, and I see questions on the chat box in the Q&A section, and I'm going to pay attention to all of those as well. So what other skill sets from Chinedu, based on this conversation and your own experience, what other skill sets would you advise pharmacists to pick up beyond traditional clinical knowledge to stay relevant in this digital first world? Did you hear that?
Yeah, I heard that when you thank you for the question.
Okay, great.
So to start with, I don't think people necessarily have to be tech geniuses to take advantage or to play a role in the whole AI space. For one, I mean, if you have interests in AI or tech or any of that, then obviously you can latch onto that and make something out of it. But if you don't, then there are still things you can do that don't necessarily involve any particularly technical skills. But generally, I'd say pharmacists need to collaborate with tech experts. And the beauty in that is the fact that if you are in the field, and that's basically what the advantage I probably would have when I finish my course. If you're in the field, then you can see the gaps in that field. You have the technical knowledge of that particular field better than any other tech person would have if the person isn't in that space. Your being in the space gives you and makes your eyes opens your eyes to the potential problems of that field, and you can prefer solutions from that space. So if you don't have an interest in tech stuff, you can collaborate with people who are in that field and find a synergy in that space, because there are things to do like I touched on medication adherence and medication patterns, um, disease patterns. Pharmacists, Karim talked about diagnostics and things like that, and pharmacist Michael has also touched on certain things too. So it's basically fostering the relationship between pharmacists and other experts, tech experts in this case, and just creating things that people need, the pharmacy community needs, and that would be solutions for pharmacists and the customers, the end users at the end of the day. And I think that's one thing Drugstock is already doing, and obviously with I'm sure you have a lot of things in the pipeline to help with this sort of things. But that's something that people can latch onto. It also helps to improve on our communication as pharmacists. And I don't mean that in the general sense of it. I mean in our abilities to communicate things to the end users, the customers, the patients, because at the end of the day, we need to be able to pass that information, relevant information to them, such that they find it relevant and they can benefit from whatever we're being passed or whatever is being passed to them. So, yeah, there are several things that we can do as pharmacists, and I'm sure I've just touched on a few, but there are definitely many things that we can do as pharmacists.
Thank you. Thank you, Chinedu. Yes, I agree. And I remember when all this talk about tech came up and everybody was going into tech. I just knew I said tech is not for me. I'm not gonna code, I'm not going to do all of that. But still, even as a pharmacist, you see that you cannot escape it. So even if you're not going to learn tech, just learn maybe the behavior of people towards tech so that you even know what kind of tech to adopt and which one you know that okay, this is not going to work in my community. But first you have to have an idea of what's trending, what's out there, it's necessary, and then that's why it's good to come for things like this so that you know what exactly is out there, what you need to have in your practice, whether or not farmers, what you need to have and how you can position it for your patients or for your customers to accept it because you know that these things are relevant. So sometimes I know that it is good to work with the behavior of your existing customers or customer base or patient base, but should also there's this other bigger picture that we are going to, right? How do I now cascade this to them? It's also important. It's also a skill to have. There are other things we can do apart from coding, but if you can code, please go for it. I mean, we need a lot of pharmacists or healthcare providers that are in this space so that products that are, more patient-centered and healthcare provider-centered are produced. I'm not saying this because I'm in a space where I am, it's not out of any bias because where I am is, healthcare provider-centered, but it's also just the experience I've had with different products, and you just know the one that has a lot of thoughts behind it and the ones that don't. Yeah, so thank you very much, Chinedu, for that. And we are coming to the end of this conversation. It's been interesting, I can't even lie. But I know that we have leaders and decision makers on the call. And I'd like from Michael to talk about how we can have this mindset. So a number of people on the call are already have digitized their operations, but we know that some haven't. And I'd like to then you talk about transforming pharmacies into modern health hubs. It requires people at the helm of decision making to make the change or, take that step forward. So I'm asking, what advice would you give to other pharmacy owners looking to adopt digital innovations in their practice? Did you get that, please?
Yeah,
What
I got
advice
the
would you
question.
give to other?
Yeah,
Okay.
I got a question. So just to rephrase, I just said that the government has a role to play in terms of harmonizing our central data such that we can draw from it and be able to serve the whole. However, as individuals, we also have some roles to play, and we need to understand and accept the fact that we are in a different dispensation. It's a different world today. Now, let me let you know that over 50% of Nigerians, over 50% of Nigerians are 25 years and below. In fact, if you go further, it gets about 60% from 30 years and below. From if you go to 35 years, we're talking about almost 65%. 40 years and below, we're talking about almost 70%. Now, and you know that our young population, especially the Gen Zs, they live online. They live online and they are very digital. As a pharmacist, very soon, if you don't begin to adopt digitization in your operation, you will be lost. You made mention about being visible. The truth of the matter is that very soon, if you don't begin to digitize your operation, nobody will know that you exist and nobody will know that you operate. And that is why I want to encourage all pharmacists and the health practitioners here. You need to step up with the times. Today, in terms of interacting with customers, I'm talking about customer experiences, there are opportunities to deploy chatbots where people can interact with the business. I mean, a lot of banks do that, and a lot of telecom operators, they do that, where generic questions, basic questions are answered by chatbots and AI. You don't need to the questions, a customer care representative does not need to answer those questions until when those questions become very personal and very specific, then it's handed over to a customer care representative. We must begin to see how step by step we will have to begin to replace those manual activities we do with digital alternative or with technology. So it's a mindset. There might be expenses that are involved in terms of cost. There's a cost aspect, probably, but probably that might be a reason why some people are not, very open to it because of the cost, dimension. But I think if you're able to sit down and dimension things and see the benefit stroke, the risk of not even adopting, probably you want to take those steps. And then probably you take those steps from the ones you can afford now, and then you scale it up as things get better. But in terms of digitization, it's something that you have to do. Today, I mean, once upon a time, there was a time when people could run a pharmacy without a software. But today, if you don't run a software, it's almost like you are living in the past. It's the same thing today, that people have to begin to take those steps that will enable them to be able to interact with today's kinds of people and with the world today. So I just want to encourage the pharmacists, just at the risk of repetition, I just want to encourage you, just accept it, know that that is the way to go. And the danger of not accepting is the fact that you not only be left behind, you will not be visible. And even the business which you are actually doing, and which is apart from serving the customer, which is also for profits, even that profit will dwindle to the point where you will run out of business. So it's something you have to do. You must decide to do it, and and probably reach out to people who are already having some form of digitization or the other, and they can show you the ropes, and that can help you, to be able to connect and adopt. Thank you.
Thank you, from Michael. That was needed, and I hope that we got the gist of that and we got the insight from it. I'm moving very fast now because we are really, because I need to, because time has gone. I'm just going to go, before I go to Farm Karim and wrap things up, I want to go to the chat section. We have had a lot of comments being dropped. Okay, someone asked, how, apart from access, does digitization allow for patient counseling and education? In fact, I think that more than any other aspect of healthcare, digitization helps counseling and education more than anything, because there is ease of access, there is ease of information being passed, ease of educating patients. You can send SMSs for people that don't, Michael has talked about how, over 3/4 of the population of the country are online. So in our own space as pharmacists, you can start putting something on across LinkedIn, okay, maybe not LinkedIn, Facebook, have your own section where you curate medical information. I said is that we can't have too many healthcare providers online sharing medical information or sharing healthcare information. We can't have too many. It shouldn't only be a couple of people doing it. If even only 1/3 of healthcare providers in Nigeria try to create some time to put out information weekly or twice bi-weekly or monthly, as frequently as possible, we will see that more people will be informed wherever they are. And then that's individually. Now for your facility, you can use systems that allow you to reach patients even when they're not in your pharmacy. I say again because it's like our technology is just apps for many of these things. I know that Pedometer, for example, helps you to send SMSs to clients even after they've left you, so you can give more information about a health condition. On maybe World Diabetes Day, you can send a blast to all your clients from the device or from your accounts, so everybody whose data you have, and then they learn one or two about diabetes. So it is a constant flow of information, and the only people I trust with information, I trust to give out the best information, are healthcare providers. Like nobody else should be in that space, giving out information about health, about medicines. Pharmacists are best positioned, of course. I mean, you can quote me anywhere. I know what I went through in my 6 years of pharmacy school. So yeah, pharmacists are best positioned to give out any info on medicine. So I feel like we're not even doing enough of that as it is currently. So there is a lot of opportunities for us to put out information, and I hope that we can leverage all of these platforms that we have. And then Chema said something about Lagos State will be collecting a fee per client from healthcare providers on. Okay, I'm not sure I get this. Okay, so how do you position ourselves for this audit and soon to come? Okay, just additional taxation. I mean, the tax is not just data, everything is taxed. In fact, we were discussing, a couple of colleagues and I were discussing about the new tax reforms, and it's everywhere. It's everybody just has to rethink how we do everything when it comes to tax. I don't want to, I'm trying to be, this is pharmacy, I'm trying to be as politically correct about any other matter as possible. But for pharmacists, I think that when it comes to collecting a fee per client, I mean, for this particular one, I have to go and read it up because this is even new to me. But for things like this, we know that healthcare providers are positioned to do this. Like this is something that we need to do. We need data, not just for our facilities, for outcomes. So this is something that we actually should talk about. I'm proposing, I know that there is going to be a poll that will go up that is going to ask us what we are looking forward to in next webinars. For me, I think I'm going to fill it, and I'm going to say that we should really talk about data and how it impacts healthcare providers, whether in your operation or any other way. Please, can we hear me still? Let's just put up emojis because I feel like, okay, thank you.
Yes,
I've seen
I
thumbs
can
up.
hear you.
Yeah, yes. Okay. So I think that is a significant topic to have. And Farm Chioma, I may be reaching out to you to be a panelist on this one, and I hope you will avail us the opportunity if it comes to that, if we decide to go on with that topic for our next panel session. Yeah, and yes, so okay. I think that's all I haven't read out. So someone asked in the comment in the question in the Q&A. Let me just read that out for everybody in case. Yeah, so the issue of cybersecurity can be overemphasized because once someone is on the internet, you don't have control over who is seeing your profile. That is a fact. So first of all, I will say that we should be very jealous with what we put out, first of all. I mean, in terms of our personal life, privacy, that goes without saying. But then how can one be sure that one's record is saved and protected? Again, like I said, whatever system you are going to adopt in your facility, whether hospital, pharmacy, academics, however you practice, I think there are some important questions, crucial questions you should ask whoever is selling this to you or pitching this to you, and how your data will be protected or how the patient data will be protected should be top list, because there is I can only speak for my organization. I know that it's painstaking for us. Data protection is something that it is top on our list. I cannot say this for any other person, but still, I would advise that whatever company you're going to partner with on tech, it is crucial to have these conversations, ask how they intend to protect your data, how they intend to protect patients' data, what are these approaches, and how they will even advise you also to do that. So it is important for us to have that covered. But someone is asking if you can put out the link on the good pill. I thought we did that before, but we'll do that again. It's already there, but it will be shared again. So as a wrap to this, I said I promised that we won't take too much of the time, and I'm gonna keep that promise. I'm just going to have a final word from Karim. Yes, please. So looking ahead, what emerging digital trends excite you the most for the future of pharmacy and healthcare in Africa? There's a lot of talk about AI. I know AI is going to be part of what you say, and I agree. I'm excited about AI myself. There is a lot that is coming through for us. So, Famkram, I'll not let you have the floor so that I don't take over the question. So, what emerging digital trends excite you the most about the future of pharmacy and healthcare in Africa?
Yeah, okay. Like you said, I am going to mention AI because it's everything. It's everything, makes everything faster. Like the person that was asked on the platform, AI is going to really help, especially with drug information. I'm just hoping it doesn't totally replace that whole department when it comes to pharmacy department, drug information department, because obviously nobody's going to be able to compete with brain power, interactions, or whatever information you can feed into it. So essentially, AI now is getting so accurate. Really, it can detect cancers 5 years even before the normal trained eye can see them. Then you're also looking at virtual reality, whereby you're looking at training opportunities using virtual reality and courses. Then I think the last one, which would is actually starting now, but it'll be more in the future, it will be wearable technology. So diagnostic tools are just going to become wearable. You'll be able to wear them everywhere. You are not going to need to, take them off. So you are looking at things like BP monitors, blood pressure monitors, glucose testing. It will now be continuous glucose monitoring. It will not just be like normal prick and test with a strip. Then telemedicine. So AI, wearable technologies, and telemedicine. And I think actually for us, all these things sound very futuristic, but actually I think we need it most in this part of the world because we are now going to just use them to leapfrog our own situation of the low resources that we have in terms of human capital, like I mentioned, and infrastructure. You'll be able to reach everybody with these tools easily. Cost is going to be an issue, but once there is a solution, then we can work back to the answer of cost. So that will be my three trends, I think, for the future, the next 5-10 years: AI, wearable technologies, and telemedicine. Thank you very much.
Thank you very much, Karim. Yes. Again, wearable technology is another thing that I see. I mean, it's already happening. It's already happening. We already have, this Internet of Things where everything is talking to people, even devices are talking to are speaking to one another. You could have your pulse, you could have your wrist, you could have a wristwatch that is detecting your pulse or your heartbeat, your blood pressure, like every time monitoring it, and it is sending the reading to maybe your doctor or your pharmacist. Maybe you have a community pharmacy that is closely monitoring your blood pressure as well. You can detect spikes in blood pressure or blood sugar in real time. Like these things are they are so exciting to think about. And for some of us that are a bit skeptical or a bit worried about this future, I'd like to remind us that I know that in my day, I had Google, I could easily go on the internet and browse anything. And I remember that my parents used to be so jealous because all they had in their day was I know that there was this big encyclopedia that has everything, or they would have to go to the library to read stuff. But I didn't have to go to the library. Like I could literally go online to in my projects in both in pharmacy school and in my master's. Everything I needed was online, right? But for the generation before mine, they probably had to always visit the library to, open books and all of that. And now the generation that we have now, please, I'd like to know if I'm still audible and visible. Where we are right now is that AI can do many of these things in seconds. So I like to position myself as how can I be better with AI? Not is AI going to replace my job? I'm human. Absolutely nothing can replace humans because we have a lot of things going for us. But we can be better with AI. That's how I see it. So in my work, I use it like that. As I see it, I don't think anything's going to replace me. I think it's just going to make me deliver better, serve patients better. And at the end of the day, it's all we remember that we are doing all of this for patients, right? For better clinical outcomes. So anything that will ensure or that will promote better clinical outcomes, I'm all for it because that's training that I received in school. So we have a final comment here from Michael. Some checklists on areas of digitization, inventory management, electronic health records, customer experience, yes, chatbots and all of that, telepharmacy, e-prescription, online pharmacy, digital payment solutions, AI-powered systems to identify interactions, etc. So you can work with a tech person or a tech company to help you adopt incrementally and at your own pace. Michael is telling us that the future is here already. Yes, and I agree. So somebody's asking if this can be done on modules basis so that after the webinar we can still have access to the materials. Yes, the recording will be shared. And so drug stock learning is something that happens. I don't know if this is your first time here from Akinwande, but drug stock learning happens every month. So we pick up topics that we know that are really on the minds of pharmacists or healthcare providers, and we talk about them. And then interestingly, from these our sessions, it informs subsequent webinars that we have, or subsequent themes or titles that we have, because conversations like this help us know what is on the minds of healthcare providers, and bringing out things, insights from people just educates everybody else. So that is what this is about. And the okay, yes, the recording is going to be shared, yes, and then we'll look forward to having you in our next webinar. Yeah, so thanks to everyone who has joined. If I didn't read out your question or your comment, please forgive me, apologies. I was trying to manage time as best as I could so that, we're not here for 2 hours. I know it's been an interesting conversation. It's been really thought-provoking as well and insightful. And I'm grateful to everybody who participated, who dropped questions or comments and shared whatever insights they had regarding the topics. Thank you very much for doing that. And drug stock learning, as always, the objective for us is to have these conversations, have thought leaders come and educate us, share insights, just bear our minds on topics and yeah, converse. So yeah, that's it. And so I'm going to wrap now on behalf of Drug Stock and Drug Stock Learning. I am Pharmacist Oye, and I say thank you once again for being part of this very crucial conversation. And I'd like to just summarize and give a few takeaways. Pharmacists, we have a critical cross-sector role in driving digital innovation in global health. Like, it is critical. You're in tech, you're in the community, you're in the hospital, you're in research, you're in drug formulations. We are everywhere, honestly. So it is important that you have all of these insights right, like at your fingertips. And also, digitization is not just about efficiency. Like, efficiency is a good part of it, but it's also expanding access to health, ensuring health equity, and advancing public health. And also, through consistent collaboration, tech, and leadership, pharmacists, we are well positioned to help achieve universal health coverage. And I know that many of us are taking that assignment very seriously, and I'm hoping that it will spread to more and more pharmacists, more and more people, even as the younger ones come up. I'm hoping that this will be the direction or the vision for pharmacists. So we look forward to seeing you at our next session. Once you'll get information and you get the details of the next session. Until then, dear pharmacists, keep leading, keep innovating, and keep making healthcare access easy for everyone. And I know it's already passed. World Pharmacists Day happened last week, but still, yeah, we are celebrating pharmacists always and drug stock. So happy World Pharmacists Day again, or happy World Pharmacists Month, and keep being amazing, everyone. Thank you for joining. Have a lovely day.
Thank you.